We're going to talk about alpha lipoic acid today. We're going to do a few minutes on that. I'm Martin Rutherford. I am a certified functional medicine practitioner and a chiropractor, 36 years. This is
Dr. Randall Gates. I'm a chiropractor as well as a board-certified chiropractic neurologist.
Okay, and we're here in Reno, Nevada, and we have inadvertently developed a chronic pain practice. And in that chronic pain practice, a significant amount of our patients are peripheral neuropathy patients. And due to Dr. Gates's background in neurology, we have a significant number of neurological patients. Dizziness, vertigo, balance patients, fibromyalgia patients that have neurological components, peripheral neuropathy, as I stated, and more, migraines, restless legs. These things have huge neurological components. Alpha lipoic acid seems to come up a lot in the patients that come in for the consults or for evaluations for those types of problems. Alpha lipoic acid has gained a lot of attention over the last several years, much of it justifiable. It's a detoxifier. It can chelate along with other things. It can chelate certain things out of your body, get certain bad minerals and maybe even metals out of your body. It's an antioxidant, and it seems to be good for the nerves. It seems to have some sort of an affinity for being good for the nerves, and as a result, many people who have come into us are taking it. We have on rare occasions had people come in and say that it's actually making a symptomatic change in their symptoms. For the most part, most people are still taking it in some hope that it's going to make a symptomatic change. The gentleman that came in the other day with the chemotherapy-induced peripheral neuropathy was taking it along with a number of other B vitamins. He indicated it made no change, which is more of what we observe. So we thought it would be good to do a few minutes on alpha lipoic acid. We are not anti or pro anything. We are what we find is helping our patients. We do these to share these clinical pearls with you that we determine are or are not useful relative to treating patients and getting some consistently successful results in the condition that is being treated. So I'm going to defer to Dr. Gates at this point. He has done the vast majority of the research on alpha lipoic acid for us. Frankly, he does 99% of the treatment. And so what would you like to share with these folks about alpha lipoic acid?
Alpha lipoic acid gained a lot of notoriety because it is known to help us process energy. It helps us to process carbohydrates and make energy. And in any neurodegenerative condition, that's something you want to look at because the nerves are dying basically in peripheral neuropathy. Some people reported anecdotal, positive responses with taking alpha lipoic acid. As you mentioned, we had one patient come in saying, my neuropathy symptoms are better. I started taking ALA. That's what it stands for. However, in our experience, most patients who have neuropathy come in taking it, and few really report a positive symptomatic outcome. Now, alpha lipoic acid also gained a lot of notoriety because probably the world's foremost researcher on neuropathy, Dr. Dick, D-Y-C-K, who practices out of Mayo Clinic as the last time I knew, in Rochester, Minnesota, did a study where he put patients basically on alpha lipoic acid, and he saw that though their symptoms didn't change, their nerve degeneration slowed down. So that in and of itself would argue in favor of taking alpha lipoic acid. We don't commonly use it with our neuropathy program because we find that if we address the underlying metabolic cause, lots of times you don't have to load the person up on alpha lipoic acid and acetylcarnitine. In a few cases we do, but most commonly we don't. So our approach is a little unique, and you may have seen it in other videos we've done on other types of neuropathy. We also have a website coming up called peripheralneuropathygroup.com, where we talk about how if we get to the underlying cause, which may be diabetes in half of neuropathy cases, but in the other half, there's like 80 other causes. And if we get to the underlying cause, and then we address that successfully, and then if the person is responsive to electrical types of stimulation protocols, melding those two disciplines can result in a positive outcome in our experience. Not all cases, but the ones we properly select seem to do pretty well. And so that is our take on alpha lipoic acid. We're not against it. We're just not completely for it.
So as somebody who's observing, just to try to bring some clarity to this, if they're not somebody who is conversant with functional medicine or functional neurology, or if they're not fortunate enough to be introduced to that, and they're taking alpha lipoic acid, but they're not seeing their feet get better, are you saying it's not harmful to keep taking it because it may slow down the deterioration? Or
so
that would be my question if I'm watching.
Okay, so you're going to know that if it is harmful, you're probably going to know in the first month. And the main adverse side effects to alpha lipoic acid are insulin neuritis, basically where your immune system may start attacking the pancreas, and that can throw off insulin levels, and that can affect neuropathy and things like that. It can also cause you to get hypoglycemic. And so those reports are throughout the literature. However, generally alpha lipoic acid is pretty safe. And as long as you're not feeling faint and weak and things of that nature, which you should consult your physician about, it may or may not be helping them. And
so watch for those symptoms.
It may be slowing down the progress of your neuropathy. Right. That's basically what the literature shows at this point.
Yeah. Okay.
Yeah.
I think that pretty much covers it. There's really not much more to it than that, but that seems to be a topic that a lot of people are interested in. So hopefully that's helpful answering your questions. If you have any more questions relative to anything like that, you can contact us at powerhealthtalk.com,
or you can go onto our Facebook page.
Okay.
Power Health is the link, and send us questions there.
Okay.
Thank you for watching.
Okay.